All right, now it's part 2 of Laparoscopic CUSA. Now I've done put the handpiece together, now it's to connect it to the machine. I'm going to show you how. You're going to find your power cord. Now this is in your circulator's hands, you get it. There's actually a notch here that you have in here inside the power and into the machine. The notch is there as well. You're going to follow it. You're going to put it upwards. Your yellow will need to be threaded to that yellow and you'll hear a lock sound. Okay, the next step is going to be your irrigator. So I'm just going to put my suction one downwards, my irrigator tubing. So the irrigator tubing that's blue is going to follow the machine. So as you can see the machine here, the blue, it's going to follow. There's actually a notch inside the machine where the irrigation will actually sit. And then it follows into the machine, that one as well, that notch, and you're going to close your machine. Snap it down. Your suction will then be put here. It's going to go through the green part, green. And you're going to push it inside the machine until it's inside. So I usually grab it and give it a good ho-heave-ho. And then I'm going to put it into my suction. The suction in here has to be very well put together. No chances of leak because you're not going to get the good suction of your tissue. Okay. Next, I've put up a liter of Ringer's lactate or saline, no choice, just a secondary IV tubing. I've flushed it. You hang it on the side of your machine. You then connect it to your water. Perfect. And that goes here. You're going to unlock your roller clamp because you don't have to have it locked here either. Put it downwards. Now it's time. Oh, I think I unclamped it very hard. Sorry about that. See, anything can happen. Okay, very good. We're good to go. We're going to turn the power on right here. Turn it on. It's going to do a self-warming check for you. It takes a little bit. Your alarms should go off. It tells you the wait button. We also have some steps to follow on the machine. It takes a little bit. Hopefully you're not too bored. You can walk away. It will tell you when it's time. You're going to hear an alarm. It's going to get you to test your handpiece. Now the connection is between the machine and your handpiece that you've put together. It's trying to test it for you to make sure that you've aligned everything properly. The power on the handle is in good shape. It's not going to be too warm. It's not going to overwork. So waiting for it is a little bit of a challenging thing as we want everything done quickly. But that's what the machine is doing. It's testing. It's making sure that it's going to be functional. I do have numbers for you to follow, as you can see. My next will be my test. This will be here. You see right now we're waiting. It'll be number 9. We have number 10. It'll be the test action. You can actually follow through it and it's good to go. So whenever you press test, do not have it near anyone. This will actually do the full function of the machine. Make sure it's free from yourself. It will burn right through you. All of the lights have to be lit. We've passed. Now it's time to prime. You're going to press it. You're going to see the numbers go up. You're going to actually see your water go through your tubing. It's going to make it all the way up your handle and your power cord, all the way up. It's going to get to the handle. We're actually going to see the water. You may have to press prime twice because there's a lot of tubing to go through. There's a big long tip to be added to it. You might have to press it twice. And once it gets there, you can see it's going to be coming up. As long as you can see the water, sometimes we forget the roller clamp, but that's okay. As long as you can see the water coming through, it's making its way. Obviously, it's not done. It's not all the way through. We did not see the water come through. It's coming now. You can see it. It will fill. It will fill. It will splash. And now it's coming. You can press stop. Okay, stop now. Your settings are usually settings, and I have the settings on the side over here for the surgeons. CUSA settings for liver resection. I want aspiration 100. Aspiration is written down here. It goes all the way to 100. Irrigation 3, amplitude 100, because we want to be able to suck up that tissue all the way through. And that is ready. Now we have to take it off standby. From standby to run. Now it's ready to go. We are going to make sure that the pedal is over here. It's going to be covered with a bag because it can get very, very bloody. So we want to make sure that we are nice to our OR attendants. So that make sure that we cover it and we pass it over to the surgeon. Make sure you got lots of cords. Surgeon ready. Now that's CUSA. Good luck.